Ladies and gentlemen, thank you for joining the Surrey Board of Trade this morning. I'm Anita Huberman. I'm CEO of Surrey City Building Business Organization, and I'm also an honorary captain of the Royal Canadian Navy, appointed by the National Defence Minister. I'd like to acknowledge that we are on the treaty territory of the Tsawwassen First Nations and the unceded territory of our Coast Salish peoples, specifically the Kwantlen, Katzie, and Semiahmoo First Nations. I'd also like to acknowledge that we work and live on the lands of the Inuit and Métis peoples as well. Ladies and gentlemen, events like this simply do not happen without sponsorship. We are a not-for-profit, and we absolutely rely on corporate support to ensure that we can have the many different events and programs to serve our business community. Thank you so much to our business and international trade center sponsors, the law firm of Fasken, the Chambers of Commerce Group Insurance Plan, represented by S&F Benefits, BDC, the Business Development Bank of Canada, and Scotiabank. If you are starting a business, need business support, need any type of support through our pandemic rapid response business center, even in a variety of languages, need trade documentation or international support, please visit the Surrey Board of Trade's Business and International Trade Center. We are now open for in-person service. I'd like to acknowledge some government officials that are with us this morning. On behalf of MLA for Surrey South, Stephanie Cadieux is her representative, Kieran Dhaliwal. Thank you. And the Consul General of Ireland, based right here in Vancouver, is Frank Flood, and his colleague Adam Duffy, Vice Consul General for the Consul General of Ireland. Just some instructions before we begin. All attendees are muted. If you have a question, please put it in the chat function of the technology and we will get to it after the presentation. If we're unable to answer your question, we will send you an email response. Ladies and gentlemen, Surrey is going to be the largest city in British Columbia by 2030, experts are saying. Surrey's business community has really gone through so much during the pandemic. And certainly we're not out of this pandemic yet. We have entered step 3 of British Columbia's reopening plan, and hopefully after Labor Day, step 4. But that means as we enter these different phases of the reopening, that businesses, organizations, communities need to think about their health and safety plans as an integral part of operating their business, operating their cities, and really ensuring the health and safety of their workplaces, of their residents. Certainly us as consumers, we want to ensure that we have the most positive experience as we enjoy our local businesses here in Surrey and in Metro Vancouver. And so, ladies and gentlemen, I'm so pleased to ensure that you have the information that you need the health and safety plans that we needed during the pandemic, and now we are going into a new phase of a health and safety plan, and that is the Communicable Disease Prevention in the Workplace Plan. And to explain what that means, what you need to do, what that means for your employees and for your consumers, please help me welcome the Director, Consultation and Education Services for WorkSafeBC, Mr. Chris Beck. Chris, over to you.
Thanks, Anita, and thanks everyone for having me today. I would also like to take an opportunity to recognize that I live, work, and play on the traditional, ancestral, and unceded territories of the Coast Salish peoples, including the Musqueam, Tsleil-Waututh, and Tsawwassen peoples. So thank you very much again. I've been to these sessions a number of times over the last year and a half, hopefully being able to provide some useful information to employers and workers on various stages throughout the pandemic, and this one being no different as we enter into step 3 and transition from COVID-19 safety plans into communicable disease prevention plans. And so I'll spend maybe about 20 minutes or so going through a slide deck, giving you an overview of what you need to know and where to find some resources that will help you. And then we can open it up for some question and answer after that. So please feel free to throw your Q&A into the chat or in the Q&A box, and we will get to those afterwards. So just bear with me for a sec. I'm going to share my screen here. Just take a second. So hopefully you can see that. Should be just be a title page that says transitioning from COVID-19 to communicable disease prevention in the workplace. And as I mentioned, we'll talk a little bit about where we are today, get into really the bulk of the presentation around developing a communicable disease prevention plan, talk about some information and resources that are available for you, and then open it up for questions. So where we are today, and I'm not going to spend a lot of time on this slide in particular, as I think everyone is very familiar with the 4-step plan that the provincial government has put forward, and that we are currently in step 3 of that 4-step plan, which started on July 1st with the anticipation of step 4 beginning at the beginning of September. And for employers, step 3 was a significant transition. Prior to step 3, so for in step 1 and 2 of the plan, which began in May, at the end of May, there was still a requirement for employers to have their COVID-19 safety plan in place. But at the beginning of step 3, that changed. And in fact, Dr. Henry initiated that communication in a letter on June 17th that is still currently available on the PHO website, which speaks to this transition to communicable disease prevention and the fact that COVID-19 safety plans would no longer be required at the beginning of step 3. And I think one of the important points within this, recognizing that step 3 is this transition period, it is the slow undoing, and I'll have to say that in my career in health and safety, which is in around 20 years now, this is probably the first time where I've ever been speaking to stakeholders about undoing health and safety protocols and practices that have been put in place. But that is really what this transition is about, is starting to ease off the requirements in the COVID safety plan and many of the protocols that have been in place. But an important point within that letter on June 17th was that Dr. Henry also recommended that employers should maintain existing COVID-19 protocols where they don't negatively interfere with business operations. And particularly during this transition period in step 3, where everyone's kind of going at their own pace. And Dr. Henry talks a lot about respecting the pace by which people are going through this transition. And recognizing that there is still some value in keeping COVID-19 protocols in place. Although the risk has reduced significantly, there is still the possibility of workplace transmission. So where those protocols didn't interfere with your business operations, it is recommended that those are kept in place at this point in time. So a really important point. But also just to build on that, WorkSafeBC is not arbitrating whether or not protocols should remain in place. There are some protocols, which I'm going to talk about, which are expected in your ongoing communicable disease prevention plan. But in terms of the protocols you had under the COVID-19 safety plan, you're welcome to take all of those down. Your COVID-19 safety plan is no longer required, and WorkSafeBC is not going to determine which protocols you should be keeping up. It's a business decision based on those protocols that you feel will not negatively interfere with your business operations. Some examples that have been given by Dr. Henry include barriers that you may have had up. It may include directional signage, such as in a grocery store where you see the arrows going up and down the aisles. If those don't interfere with business operations, then again, it is recommended that they are kept in place. So what is communicable disease prevention? What does that plan look like, and how does it differ from COVID-19? Hopefully I can maybe allay many of the fears or the anxiety around, oh, here we go again with yet another plan that we need to develop. In a lot of ways, the communicable disease prevention plan is a subset of your COVID-19 safety plan. So it is really, it is intended to not be a lot of effort to transition from COVID-19 to communicable disease prevention. And the reason we're going to generic communicable disease prevention is as we transition out of COVID-19, or as we transition away from the pandemic, there's a recognition that communicable disease prevention is an important piece to all health and safety programs that employers have in place. And that could apply to any communicable disease. So COVID-19 obviously being the one first and foremost right now, but you can include influenza, norovirus, avian flu, many other communicable diseases that could potentially transmit in the workplace, and how these steps can apply to that overall plan that you have in place as part of your health and safety program. So you might recall in the COVID-19 safety plan, we had 6 steps. And what we've done is we've tried to simplify that a little bit in transitioning to communicable disease prevention. And we have modified that into 4 steps, which really do mirror in a lot of ways those 6 steps that we had within the COVID-19 safety plan. And I'm going to walk through them at this point in time. So step 1 being understanding the risk. Now, you'll recall step 1 of the COVID-19 safety plan was assessing the risk. And the reason we've changed the terminology there is because in COVID-19, it was around assessing the risk in your workplace and really understanding the risk in your workplace. Where were the possible areas in your workplace where transmission could occur? In step 1 of the communicable disease prevention, we're not necessarily getting down to that level of detail, but you need to understand the risk at more of a global level. Monitoring and reviewing communicable disease prevention information that is being issued by the provincial health officer or the regional health officers, and any orders, guidance, or notices that are being issued. So recognizing that the risk is low in most workplaces and in most places at this point in time, but there could be outbreaks. Those outbreaks could occur at a local level, a regional level. They could occur within a specific workplace. And the intent is to then follow the direction of the medical health officer or provincial health officer in those situations. So it's not about necessarily within your communicable disease prevention plan assessing the specific areas in your workplace that will increase the risk of transmission, because that risk is actually quite low in a general sense. It's about understanding the risk at a global level and paying attention to the communications that are coming out from the regional and provincial level. Now, if there is any guidance provided at the regional or the provincial level, employers are required to follow that guidance in the direction provided, just as we have been with all of the orders that have been in place throughout the pandemic. Now, step 2 really gets split into 2 pieces. We've got those, if you look at the orange text, there's the ongoing measures that employers are expected to maintain at all times. And I'm going to jump ahead a slide and then come back. And then there's, again, looking at the orange text, the additional measures that would be implemented as advised by public health if there is that local or regional outbreak. So let's talk first about the ongoing measures. The ongoing measures, there are essentially 5 points that we have put within these ongoing measures where it is expected that employers are going to maintain these 5 points at all times. So I'll walk through these. The first being policies to support staff who have any symptoms of any communicable disease, and supporting them so they can avoid being in the workplace when they're sick. So essentially having policies in place to allow them to stay home when they are sick. And in fact, to expect them to stay home when they are showing any signs or symptoms of communicable disease. The second is providing hand hygiene facilities. Now, even prior to the pandemic, this was a requirement in the occupational health and safety regulation, was to have hand hygiene facilities available to have hygiene facilities available to staff, so washrooms and cleaning facilities. So this is no different at this point in time, but it is emphasized within the communicable disease prevention plan because of its importance in the prevention of communicable disease transmission, and reminding employees through policies and signage that they should be washing their hands regularly and using appropriate hygiene practices. The third being maintaining a clean environment through routine cleaning processes. Now, during the pandemic, you'll recall that there were recommendations coming out from the BCCC around the frequency by which employers should be cleaning surfaces. Typically, it was either once a day, or twice a day, depending on the type of environment that you worked in. That guidance is, in terms of the specifics on the frequency, has gone away, and really it's around maintaining a clean environment that is appropriate for your workplace and your working environment and the types of exposures that could potentially occur. So if you are a business that has the general public coming in on a regular basis, you may have more frequent cleaning procedures than an office setting where you have, just the workers that are coming in on a daily basis. So it really just depends on the workplace that you're working in and what you believe is going to be appropriate cleaning, as long as that cleaning is occurring. The fourth is ensuring that building ventilation is adequate and that the ventilation systems are properly maintained and functioning as designed. So it's really following the manufacturer's instructions on the ventilation system that you have in place. Now, this typically really applies to indoor facilities, but if you do have a ventilation system in place, then you need to ensure that it's working adequately and working as intended by the manufacturer. Now, again, this was already a requirement prior to the pandemic, and it can be found in the occupational health and safety regulations. So it's very clearly laid out on what you need to be doing as the employer, what your responsibilities are related to building ventilation. Now, the fifth one is an interesting one. It's around supporting employees in receiving vaccinations. So not mandating vaccinations, not telling your workers that they have to go get vaccinated, but supporting those workers who do wish to become vaccinated and encouraging workers to become vaccinated for any vaccine preventable condition. Now, again, right now we're talking about COVID, but this could really apply to influenza. We have an influenza vaccine that comes out every year, and encouraging your staff and supporting your employees to go get that vaccination is an important component of a communicable disease prevention plan. Now, as I mentioned, if there is an outbreak at the local level, at the workplace level, at the regional level, then following that direction of public health and the medical health officers, regional health authorities, is going to be really important. And in some cases, there may be a requirement then to implement more measures. Now, we would not expect that those measures would be anything above and beyond what was already implemented during COVID. And that would apply to things such as physical distancing, barriers, possibly, mandating masks again, enhanced cleaning and disinfecting, with very specific protocols on what that would look like. And then for workplaces where you have joint transportation, or possibly the congregation of workers in accommodations like camps and things like that, there may be modified practices that are required in those situations as well. So again, in this case, it's about really following the direction from public health and the medical health officers, and the expectation from WorkSafeBC's perspective that if orders are put in place, that those orders are being followed by the employer. Step 3 is, I'll say, a combination of what was step 3 and 4 in COVID-19 safety plans. Step 3 in COVID-19 was around having your policies in place. Step 4 was around communicating those policies. So step 3 is really a combination of both of those. So ensuring that you have the policies and practices in place to support those measures that we just talked about, ensuring your workers know and understand those policies and procedures, particularly around staying home when sick, working from home, whatever that might be, posting signage, ensuring that you've gone through training for any protocols that might be in place, ensuring that your supervisors are knowledgeable and that they're providing adequate supervision, and providing information to workers in a language that they understand. Now, the italicized text at the bottom of this screen is an important point as well, is being mindful of some of the aspects of managing communicable disease in the workplace that may raise privacy and confidentiality issues. And I'll address this right now because it's been a question in every webinar we've done on this over the last couple of weeks, is around the mandatory vaccination piece. And the question being, can we mandate vaccinations? It's what we are essentially saying at this point in time is that, that is going to be potentially based on what type of workplace you are in and the type of work that you do and the type of exposures that you may have. But if you as the employer, and this really is the decision of the employer, unless if there's direction that comes out at the health authority or the provincial level, which to date there has not been, but it's really a decision of the employer that if you decide to go down that road, we do strongly recommend that you seek legal advice and consider the balance between health and safety, privacy, human rights, and labor law. There are a number of factors to consider before you go down the road of looking at a mandatory vaccination policy or anything similar to that. So just consider that as we go forward. And if there's other questions related to that, we can go over that at the end. Step 4 is essentially the same as step 5 in Communicable Disease Prevention Plan. That's around monitoring the workplace and updating your plan. So this is your plan, do, check, act approach, considering that things will change, things will work, some of the protocols you're implementing might work well, some might not work well. You might get feedback from your workers, and that you consider that feedback and you look at anything that's changing at the provincial or regional level, and that you're keeping your plan up to date is really what step 4 is focused on. Now, I've used this in prior presentations, and it's still an extremely important point, is the involvement of your workers. As we talked about during COVID-19, there was a lot of fear of exposure. People might have been caring for elderly. They might have underlying health conditions themselves. A lot of fear coming back into the workplace and potentially being exposed in the workplace. That fear kind of still exists. As I mentioned at the beginning, people are going through this transition at their own pace. Some people, and we've heard this, might feel that things are being lifted too quickly. And is it really safe to come back into the workplace? So it's really important that you're involving your workers in this process. Now, this whole idea of joint health and safety committees and worker health and safety representatives, that's already a requirement in the Act and the regulation, depending on how large you are as an employer. So it's important that you understand that structure and understand what your requirements are as an employer. But the overall premise of this is the importance of including your workers in that discussion around health and safety. And the development of your plan and the protocols that you're putting in place. I can't emphasize this enough. Very important point. So what's available to you? Some information and resources to help you along the way. We have updated our webpage, our website, with the links available here on this page. And we essentially now have one page that speaks specifically to step 3. And it walks through everything I've just talked about. And we are keeping that page up to date. You'll see in the little box in the middle of the screenshot there, new June 30th, planning template added to employer guide. And really what that's getting at is there is, when we talk about communicable disease prevention plan, there is no requirement to have that documented. Different from the COVID-19 safety plan. So that COVID-19 safety plan, you needed to have it documented, you need to have it posted. Communicable disease prevention plans don't need to be documented. You won't have an officer from WorkSafeBC coming out and asking to see your written communicable disease prevention plan because it's not a requirement. However, we have heard from many employers over the first couple of weeks that they would like to see it documented. They would like to document it for communication purposes. They would like to document it within their overall health and safety program. And therefore, we have created a template that is now available on our webpage. So we are keeping the webpage up to date with resources that are available for you. We've also got a great frequently asked questions section that's continuing to be built out on our webpage that I would recommend you take a look at on a regular basis. We've still got information on the web pages around claims and what's happening with claims. What you will notice, though, that's now no longer on our website is all the industry-specific COVID-19 information. We have pulled that information down because we're getting away from specific COVID-19 safety plans at the industry level that are specific to an industry situation or a type of workplace, and we're going to this generic communicable disease prevention, which I've spoken about the 5 points that are expected to be in place for all employers. Having said that, though, there were lots of resources that we had developed that are still applicable and still valuable in the maintenance of your communicable disease prevention plan. That includes ventilation, air circulation resources, hand washing resources, posters that you can put up on occupancy limits if you decide to keep those in place, posters around encouraging workers to cough or sneeze into the crease of their elbow or into another covered situation, not their hands, and how to properly use a mask. We are transitioning all those resources to get away from speaking specifically about COVID-19 and modifying them to support communicable disease prevention in general. So I do recommend you take a look at the website and continue to utilize those resources as you're putting your plan together. We've also developed a guideline. So if you're familiar with how our structure is set up, we have the Workers' Compensation Act and then the Occupational Health and Safety Regulation. And under that regulation, we've got policy and guideline. And that policy and guideline provides further information to employers on how to interpret the Act and the regulation. So under Section 21 of the Act, which is the General Duties Clause for employers, we have developed a guideline specific to communicable disease prevention that really just goes through in detail what I've already talked about so far. And that's available for employers as a resource, so that if an officer was to come out and do an inspection, that you would know what the expectations would be and what they'd be looking for. And I'll talk a little bit more about our approach and what we're doing in a few slides here. Also important, and this was kind of step 6 under the original COVID-19 safety plan, but still important that employers are considering all the health and safety risks in the workplace. We're transitioning away from COVID-19. We're moving into communicable disease prevention as a part of your overall health and safety program, but there are many other risks in the workplace that can lead to serious injury, disease, and death that you need to keep your eye on as an employer, and ensure that you are focusing on risk mitigation and control measures in place for those risks as well. So some common issues and questions. We saw this a lot through COVID-19, and I anticipate we're going to continue to see this, particularly with those businesses that are front-facing with the public, such as restaurants, hotels, retail establishments. We've seen this in the news where there has been violence and abuse, either verbal or physical, that has occurred as a result of customers not wanting to follow the COVID-19 protocols that have been in place with employers. We may see the same thing as we transition away from COVID-19 into communicable disease prevention, and what you decide to keep in place as an employer. There may be conflict with people that maybe don't want to follow those rules because there's no longer provincial orders in place, or whatever the case may be. If there is a potential for any violent situation or abusive situation within your workplace, you need to ensure that A, you have the appropriate violence prevention program in place, and B, that you have trained your workers appropriately on how to address those situations should they arise. This, again, is already a requirement in the Occupational Health and Safety Regulation, even prior to the pandemic. And we have lots of great resources on our website that can help you put this together to ensure that you are focusing on violence prevention as well. Mental health has been a huge topic of conversation over the last year and a half, and continuing to grow, and will continue to grow, not necessarily specific to COVID, but just in general. And recognizing that psychological health is as important on the workplace as physical health. We have some great resources here that we've developed, a guide for employers and a guide for workers that are specific to mental health in the context of COVID-19, but the principles of that apply to mental health in general. There's also a lot of other great resources here that have been created by other organizations that will be valuable as we transition out of COVID-19 and into I guess our new normal, whatever that new normal is going to look like. Working from home. Many employers we've heard from are going to continue the work from home situation, which is great. And if that works for you, you're more than welcome to do that. But it is important to emphasize that if you are going to continue to have your workers working from home, that you understand that the responsibilities of you as the employer still exist, and you need to have a working at home policy in place that looks at hazard and risk assessment of the at-home workplace, that looks at the ergonomic setup for your workers. It looks at emergency procedures, education and training, check-in procedures, so on and so forth. We're not saying you as the employer are going to go out to your workers' homes and do an assessment. You run into some privacy issues there. But it is recommended that you are working with your workers who are in the home environment to do your due diligence, because if an injury was to occur in the course of their work duties in the home environment, that is still the responsibility of the employer from a prevention and claims perspective. We do have some resources available to you, a number of links at the bottom of the slide here, and these slides will be shared after the session today. The first one, how to make your computer workstation fit you. Great resource for workers and for employers. Really, ergonomic risk is your largest risk in the workplace outside of any emergency situations that could occur. And we've also got some resources there around doing a checklist type format to be able to do that hazard and risk assessment within the home environment. So I recommend that you take a look at those. Now, from a frequently asked questions perspective, as I said, we're building this out on our website daily. So things are changing on a daily basis as we continue to hear from stakeholders where the challenges might be, and then provide more information on our website. But just a couple of them here. So the first being, do communicable disease plans need to be written, documented, or posted? So as I mentioned earlier, the answer to that is no. Unlike COVID-19, they don't need to be documented. You will not have officers coming out and asking to see a documented plan, but we do have a template available for you if you would like to document that plan. Can employers maintain COVID-19 protocols if they choose? So yes, absolutely. You can continue with your COVID-19 safety plan as long as you like. In fact, as I mentioned right out of the gates, it is recommended from Dr. Henry that you maintain those that don't negatively impact your business operations. Will masks be required? So masks are no longer required, as that order has been removed, but they are recommended, and they are recommended for anyone over the age of 12 who has not yet been fully vaccinated. And fully vaccinated means that you means 14 days after your second vaccination, and it is recommended that that you continue to focus on if you are going to have a mask mandate in place, that you are continuing to focus on the needs of all of your workers, and considering those needs as you're going forward with whatever policies you're going to have in place related to masks. Are there industry-specific protocols for communicable disease prevention? We are moving away from that at this point in time. As I mentioned, that's been taken off of our website, and we are going to more generic protocols. And then the last one there, am I still required to do daily health checks? And the answer to that is no. So the mandated daily health checks for your workers are no longer required. As an employer, you don't need to ensure that those are occurring. However, you will recall that the first point in the ongoing measures for communicable disease prevention is policies in place to support your workers staying home if they have any signs or symptoms. So really, for workers to know if they have any signs and symptoms, they do need to be doing that health check on a daily basis. It's just not mandated. It's not mandatory. However, if your workers do have signs or symptoms, they should be staying home. And I know there's some questions that have come up that we can definitely get to after this last slide here, which is really around questions. And I wanted to mention that we are taking a very consultative approach to this, similar to what we did at the beginning of the pandemic. Our officers are not out there doing a specific inspectional initiative on communicable disease prevention. However, as a part of their regular inspections related to other risks in other industries, or in all industries, I should say, they are asking some questions. Do you have any challenges as an employer transitioning from COVID-19 to communicable disease prevention? Do you understand what communicable disease prevention is all about? So we are taking a very consultative approach. My team is out there working with industry as well, and checking in to see if there's any challenges that may be arising. But you don't have to wait for us to come to you. You can also directly contact us. Our officers on the other end of our support line, prevention information line, are answering questions in a very consultative manner. We're picking up the phone within 30 seconds. Usually it takes no longer than about an hour to provide a full response. The phone numbers are there, and I do recommend you reach out to us if you have any questions. In terms of today's session, you are more than welcome to email me. I can guarantee my response rate is not 30 seconds, but I will do my best to get back to you as quick as I can. You can also email our general inbox at consultationservices@worksafebc.com. That is more so geared towards industry associations and setting up sessions and webinars and things like that. And if you do ask a question specifically about your communicable disease prevention plan, we will likely forward that on to the prevention information line, where it can be documented and responded to appropriately by our officers. So with that, Anita, I'm going to stop sharing my screen, and I'd be happy to open it up for any questions and discussion that may come forward.
Thank you so much, Chris. And thank you to WorkSafeBC for always being there, especially during the pandemic. Never before have we really needed WorkSafeBC and the guidance through the Ministry of Labor as well, in relation to navigating our businesses, our organizations through the pandemic. And certainly WorkSafeBC, you've been a resource to us. And also we have your information on our Rapid Response Pandemic Business Center at businessinsurrey.com as well. Chris, I wanted to first of all ask you, in light of the variants, and I know that ultimately it is up to the provincial health officer to determine any changes to the health orders, but do you think it's wise just to keep the existing health and safety plans that businesses have worked so hard on already, just to keep them in place in light of all of the variants and the uncertainty?
Yeah, thanks, Anita. I mean, I would suggest in terms of the variants, WorkSafeBC isn't necessarily the experts when it comes to that type of information, and we'll leave that to public health in terms of the variants and how well the vaccines are preventing transmission of those variants and so on and so forth. But really, when it comes down to your question, which is around maintaining those protocols, yeah, I mean, we would like to follow the direction that public health is coming forward with, in that it is recommended that employers are maintaining those protocols in place, again, where it doesn't impact negatively on their business. And that's going to look different for every employer. There's no requirement to keep those protocols in place other than what we've outlined in communicable disease prevention, but it is recommended that employers are doing the best to keep those protocols in place, particularly during the transition period as we approach step 4 and into the fall.
So I just wanted to ask you again, I know you briefly articulated this. So no employer has the right to ask their employee for an immunization record in order to work. It is illegal to do that. Is that correct? Or legal advice is needed?
Yeah, I'm not a legal expert. So what we are recommending, what WorkSafeBC is recommending to employers is that if they are going to go down that road, that they should be seeking their own legal advice on that, because it is a balance between health and safety, privacy, human rights, and labor law. There may be possible work settings that where a mandatory vaccination policy could be appropriate. Healthcare comes to mind, and I'm not saying that employers have done this. And I'm also, as far as I'm aware, there has been no direction at the health authority or provincial level along those lines. But there could be certain work settings where it might be appropriate for employers to have that mandatory policy in place, where then possibly proof of vaccination would be required, or where a worker is unable to become vaccinated, that accommodation measures are put in place for that employer through human rights. So what we are recommending and strongly encouraging is that if employers are considering that they are getting their own legal advice on that. We're not the legal experts from that perspective, so that would be up to what falls under the privacy, human rights, and labor law, that employers should be seeking advice on that themselves.
Can you explain the first sentence in this plan referring to excluding businesses with ECP? What kind of businesses do not need to do this plan?
Yeah, so great question. And ECP is exposure control plan, and there's already within the Act and the regulation, there are already requirements for certain employers, certain work settings, certain employers in certain work settings to have exposure control plans for communicable diseases already in place. And again, healthcare is the best example of this, where in healthcare, particularly your acute care or possibly long-term care settings, you have patients and the public that are coming into that setting. And in a lot of cases, they are coming into that setting with communicable diseases. And as a result of that, even prior to the pandemic, many healthcare settings were already required to have exposure control plans in place for the possibility of transmission of communicable disease within that work setting. So that is a much higher standard, and the expectations within that exposure control plan are much different than what we're talking about here in communicable disease prevention in a generic sense across all workplaces. So those employers who were already required to have an exposure control plan in place for communicable diseases from a hygiene perspective, they do not need to follow the communicable disease prevention plan because their plans are already well above what would be required within communicable disease prevention.
Can you provide your perspective, because this was really a new thing that happened during the pandemic, is around ventilation systems in buildings being enhanced to prevent transmission. Do you think that's important? Do you think building codes need to be updated? What's the health and science behind that?
Yeah, there has been a lot of discussion on ventilation systems throughout the course of the pandemic, probably more so than other than maybe some industries, more so at a global sense or provincial sense than we've ever really seen before, and a lot of focus on the movement of air. And I think there's still some debate out there amongst the experts, me not being one of them when it comes to transmission of disease, but the experts out there around how COVID transmits and whether it is aerosolized and how that moves. But the important piece throughout all of this is that outdoor, and Dr. Henry has talked a lot about this, public health has talked a lot about this, that outdoor has always been better than indoor because you have that movement of air in an outdoor facility. In an indoor facility, you can possibly get stagnant air where the disease particles themselves can start to build up in that enclosed space, depending on how large the space is and how many people are in that space. So that movement of air is important. Now, again, this was already a requirement prior to the pandemic, where having ventilation systems in place and that movement of air is a way of improving the air quality and the hygiene side of workers working within an indoor workspace. So if your indoor workspace has a ventilation system, then it is important that that ventilation system is being maintained and is operating as intended by the manufacturer. And particularly as buildings get older, they typically require more maintenance. And so it becomes even more important for the employer to ensure that their ventilation system is being regularly inspected, and that when it is inspected, if there is anything functioning incorrectly with that ventilation system, that it is being fixed and that the system is working appropriately. Now, there are also potentially indoor settings that don't have ventilation systems, and that is where the employer can consider other forms of ventilation. If there was an increase in the risk and direction provided by public health, it may be opening windows or doors. It may be having fans that are pushing air down from the ceiling. There are other ways of doing that. And that you would, as the employer, would have to seek advice on what might be required for your particular work setting. But the important point here is for the employers that do have ventilation systems in place, that those do need to be kept up to date and maintaining as per manufacturer's instructions.
Well, fall season is before us, and last fall we really didn't face impacts from the flu. Do you think we need to prepare for the cold and the flu season in addition to COVID, which is going to be with us for a very long time, and its variants? Or is that already covered by this communicable disease prevention plan? What's your perspective?
Yeah, it is covered, and that's actually we had a lot of discussion at the point of the announcements at the end of May about this 4-step plan. Between then and the announcements of step 3 in communicable disease prevention, we were meeting with public health regularly, and there was a lot of discussion on what this would look like in the context of the workplace and how WorkSafeBC and what our role would be in promoting, consulting, educating, creating that awareness around communicable disease prevention, and even down the road, potentially enforcement of communicable disease prevention plans as part of an overall occupational and safety program. And as we work through that, and looking at communicable disease prevention, one of the reasons that we are transitioning from talking specifically about COVID-19 and moving into communicable disease prevention is because we are hopefully on the tail end here of this pandemic. And you're right, COVID will be with us forever. But the thought is, as the population becomes vaccinated, that it becomes something that's very similar to the flu. Now, it's still yet to be determined whether or not we're going to require vaccinations on an annual basis, such as the flu, or whether there's going to be a booster required every 5 years or 2 years or whatever that's going to look like. Time will tell on that. But the intent here is that employers are considering communicable disease prevention in a global sense, and the protocols that are being put in place, really those ongoing measures apply to any communicable disease that could come into the workplace. So this is where we're talking about influenza. This is where we're talking about norovirus, H1N1, COVID-19, whatever those communicable diseases might be. That communicable disease prevention plan is meant, those protocols are meant to consider that. So if we think about the 5 pieces of that communicable disease prevention plan, the ongoing measures of supporting your people to stay home when sick, ensuring that hygiene facilities are available and that you're encouraging your workers to wash their hands regularly, having regular cleaning of surfaces and cleaning of your workplace, ensuring that your ventilation systems are working properly, and supporting your workers in becoming vaccinated, encouraging your workers to become vaccinated. Those apply to any communicable disease, so influenza being one of those. So as we enter into the flu season, if as the employer you're considering those 5 components related to influenza, then hopefully we will see a minimal impact on the flu season as we enter into the fall and into the winter.
So we can encourage workers to be vaccinated, but we can't mandate it, and we can't ask them if they are vaccinated. Is that correct?
Well, again, it's not as black and white as you can or you can't. And I know I know it's tricky in these types of situations because I'm not necessarily providing you with a black and white answer. There may be some workplaces where, as the employer, you determine that a mandatory vaccination policy is appropriate, but that's not up to WorkSafeBC. And what we are saying is, if as the employer you are going to go down that road, we are recommending that you seek advice on that. Because again, there are privacy, labor law, and human rights implications on going down that road. So, we're not going to tell you you can or you can't, but if you are considering it as an employer, you need to seek advice, because that gets outside of just the occupational health and safety regulation in the Act, which is our jurisdiction, our mandate.
Chris, what happens when someone gets COVID when they're at an event or in the workplace? What should they do?
Well, getting COVID, you should be following the same direction from public health. There's sort of 2 pieces, I guess, to this answer. The first is you should be following that direction of public health, meaning that if you're demonstrating any signs of symptoms, that you are isolating yourself. So if you're already at work, then you're going home from work. If you're at home, you're not coming into work, type thing. And then following up with your medical provider and following the direction of the medical providers on what would need to occur specific to your treatment, your return to work, what that would look like for your particular case. So that's the one piece of it, is following direction from the healthcare providers. The second piece is around the potential claim. If you believe that you contracted COVID in the workplace in the course of doing your duties, then we do recommend that you submit a claim to WorkSafeBC. Now, as I think most employers are aware at this point in time, the Schedule 1 provision was accepted, I want to say it was August of last year, I can't remember the exact date, but that there is a presumption in place that that if workers are presumed to have received COVID in the workplace, then their claim will be automatically accepted. Now, we have lots of information on our website related to the claims process, but the one piece that has come up actually a lot in these webinars is that Schedule 1 presumption is one of the factors is directly tied to having a public health emergency in place, or a state of emergency in place. Now, I think as many people are aware at this point in time, the provincial state of emergency has been lifted. There is no longer a provincial state of emergency in place. However, there is still a public health emergency in place in BC. And as long as that public health emergency is in place, then the COVID-19 presumption is in place on claims, which means if you submit a claim and there is good evidence to show that it occurred while you were in the workplace, then your claim will be accepted. Once that public health emergency is lifted, then the presumption no longer exists, which means it would have to go through our typical claims process, where there would have to be a demonstration of evidence based on the process that our claims advisors, our claims managers would go through to determine whether or not the workplace was the sole source of that. And that becomes much more challenging when you might have community transmission of a disease. So that presumption is in place now, but only until the public health emergency has been lifted.
What about if you're at an event, whether it's a concert or a corporate event, and someone gets COVID? Uh, do people report it to the organizer? Do people report it to the hotel? Do people report it to WorkSafeBC? What's your advice?
Again, it would be the same as what occurred during COVID-19, which would mean that you are reporting to your medical health providers, and then your medical health providers will provide direction at that point in time. So through contact tracing and so forth, it's possible they might ask you to connect in with the organizer of the hotel, but in all likelihood, it will be the folks that are responsible for contact tracing in public health that will do that follow up and determine what the exposure might have been beyond just you as the individual. Now, if you were at that event as a worker, then my response to my prior response, I guess, still applies, that we would also recommend that you are putting in a claim to WorkSafeBC and determining whether or not that could be acceptable.
So if someone gets COVID at an event, because a part of our business, for example, is events, and we're trying to reopen events to reopen the economy, could they start a legal lawsuit against the venue or against the organizer?
That would really be up to the legal advice that individual would seek. That's unless if it's a worker in the workplace at that time who is then submitting a claim, that would then fall under, I'll say, the jurisdiction of WorkSafeBC. Anything outside of that, and whether or not an individual would want to seek legal advice or would want to seek legal action on that event or that venue or that hotel, that's up to them and the legal advice that they would be seeking related to that. That's not really within our mandate.
So one of our attendees just said in the chat that now we just need to surround ourselves with lawyers and good legal advice in order to ensure that we're doing everything properly, because really, that is an added expense to the bottom line for all of us, but important to have good legal advice. I wanted to ask you about sick pay and paid sick leave. So first of all, how do employers apply for reimbursement of COVID-related sick pay, and who is eligible for reimbursement?
Yeah, great question. We've got lots of information available on our website on this, so I would recommend folks take a look at that. But essentially, if you don't have as an employer, if you don't have a short-term disability or sick leave plan in place for your workers, then you as the employer can apply to be able to have your workers covered for up to 3 days. That is related to 3 days in this calendar year that's related to COVID-19. The application process right now, at this point in time, WorkSafeBC is administering that on behalf of the provincial government until the end of this calendar year, until the end of December. And then our understanding at that point in time is the provincial government will take over that program. But because we already have had a process in place for being able to operationalize that, we were able to do that fairly quickly. So we are administering that on behalf of the government at this point in time. So you would contact WorkSafeBC as the employer, apply for that, submit the potential evidence of the workers who have actually been off for that period of time, and then you will be reimbursed. The reimbursement process is, I think we have said it's up to 10 business days, but my understanding is it's actually been occurring a lot faster than that. So within about 4 to 6 business days, the employer will be reimbursed for that sick leave that occurred.
Are employers disqualified if they already have some coverage of sick pay, for example, salaried employees?
If the employer already has a sick leave program in place, then yes, my understanding is that they are not eligible for the program that has been established by the government.
So I just getting back, my final question to you is around the plan. So if an employer says, so, some people need to wear a mask and some people don't, does does an employer need to establish a plan that blankets everyone, or just different departments, or what's your advice on that?
Yeah, the expectation is that the employer would have in place a communicable disease prevention plan for all workers. Now, the how that plan applies to different departments, different groups that might be exposed to the public, there might be some differentiation there. Or actually, maybe if I think about the five components, I mean, that first component around encouraging workers to stay home when they're sick, that applies to any worker in the workplace. Same with the hygiene facilities. Any worker coming into a workplace has to have access to the hygiene facilities. Your cleaning protocols might look a little bit different depending on the various work locations, departments, situations that you have. Those that are publicly facing might have a different cleaning protocol than, I'll say, the office in the back end type situation. So you might see some differences there. Around ventilation systems, you also might see some differences relative to your staff that work outside versus your staff that work inside, or depending on the size of the space that they're in indoors. And then the last component around vaccination would really, that's meant to support all individuals that are in the workplace, all workers that are in the workplace. So yeah, you might see some differences, but the idea of having a communicable disease prevention plan that is applicable to all workers within the worksite, and even looking at that from, you know, the contractor, subcontractor, prime contractor type relationships, that those situations, the owner and the prime contractor should be having those discussions with their subcontractors about how those plans align across the various businesses, as they would with any other health and safety risks and any other health and safety controls that would be in place under a health and safety program.
My this is going to be my last question to you, and I thank you so much for speaking with us. Is the COVID-19 pandemic really was a learning template, I believe, for WorkSafe BC, and this is not going to be our last pandemic. Just if you can articulate, from your own perspective, how can WorkSafe BC better prepare for pandemics? What have you learned?
Yeah, it's a great point, and something that we have been discussing a lot over the last number of months, as we're starting to see things open up again, is how can we utilize this information to be able to learn and go forward. And I think, there's sort of a number of levels to that. I think if we look at how workplaces are preparing for the next pandemic, I think we hit a point during, you think back to H1N1 and SARS. And some of the things that were done, particularly within healthcare, we learned some things from that process. But this is really the first time where we've had a globalized pandemic, at least in the last 100 years, a globalized pandemic where we've been able to look at, well, what does the workplace situation look like when you have a pandemic circulating in the community, and the protocols that we have put in place over the course of the last 18 months. Again, I think about barriers, directional signage, having people work from home, masks, other things like that, physical distancing, all that sort of stuff. I would expect that if we get into another pandemic, when we get into another pandemic, that it would be a matter of dusting off those COVID-19 safety plans and those protocols, and getting those in place as quickly as possible after there's a recognition that the pandemic is there. And I think it's really the time that it took us to figure all of that out. And I mean us being public health, WorkSafeBC, BCCDC, and others. When the pandemic first became a pandemic in March of last year, it wasn't until May 17th where we actually implemented the requirement for a COVID safety plan. That was 2 months. A lot can happen in 2 months. So I would say one of the learnings is a pandemic hits again 5, 10, 15 years from now, whenever that is, that you would say, okay, we've got a pandemic. It's been recognized globally, or even an endemic locally, that we are putting those plans in place right away. Those similar protocols are being implemented immediately to try and minimize the transmission. So that would potentially be one learning that we would see going forward. I think the other learning that's maybe more internalized for us is even our interactions with public health and the health authorities. Yes, we've interacted with public health and the health authorities in the past, but not to this extent. And every organization operates just a little bit differently. And I think we've learned a lot in terms of how we can mobilize all of our teams that are involved in these types of decisions, being WorkSafeBC, BCCDC, public health, the government, name it, all these organizations that have been involved in making these decisions, and be able to mobilize teams to be able to have those conversations and have a structure in place to be very, almost like your emergency response command center, that having that type of situation in place to be able to react quickly and make those decisions quickly, I think is something that we will learn from this as well. And at the employer level, I think employers need to and should be understanding of the fact that, as you said, Anita, this is likely not the last pandemic we're going to see, and in all likelihood, we're going to see them much more frequently. And so employers should not begin to think that they can just put this away, throw out all their barriers. If you have a place to store those barriers, you might want to consider storing them and keeping them on hand, because we may need them again in the future.
And so, ladies and gentlemen, never before has healthcare, business, government, labor been so interconnected with each other, and it will be into the future. Thank you, Chris, and to WorkSafeBC for being with us this morning. And the presentation will be sent to you after the session is over. Thank you for joining the Surrey Board of Trade. Make it a great business day.